Dear colleagues, welcome back on Endo Channel by Gianluca Plotino, my web-based project of lessons that this year will be increased with this session that is called Not Only Endo 2020. This session will be on particularly attractive topic related to some restorative and preventive parts. So this first lesson will deal with an innovative method to arrest incipient carious lesion. So the background on this module 1 of the Endo channel will start from the evaluation of the carious process. So we know by definition that the E0 stage is no lesion carious process. But then we can have different stages of the carious process, starting from the healthy tooth to the mineralization, then the presence of white spot, then will transform with time on brown spot and cavitated enamel until a very big and open cavity of carious lesion. So when we speak about classification of the depth of the carious lesion, the first stage is the E1 stage. The E1 stage is a carious that is on the outer half of the enamel and that appears radiographically similarly to this image that you can see here. The E2 stage is a stage that goes in the inner half of enamel and radiographically can be evaluated in a lesion that stays still in the enamel. Then, proceeding deeper, the classification speak about a D1 stage of the carious lesion that is localized already in the outer third of dentin. So it's the carious lesion that is already invading the dentinal tubules and the dentin tissues. And then the next stages include the D2, in which the carious lesion goes in the middle third of dentin, and so we can see frank appearance of dentin involved, and the D3 lesion in which this stage, in which the stage is in the inner third of dentin, approximating the pulp chamber. Most of the cases in D2 and D3, but sometimes in D1, they are already cavitated lesion. When we speak about the incipient carious, the incipient lesions in E1, E2 and D1, we are speaking about some cases that the World Dental Federation, FDA, has classified in the white paper on dental caries prevention and management that you can find at this website, such as an initial caries or moderate caries. Because after that no clinically detectable caries, we do not perform any treatment and we have only to perform a prevention, primary prevention, then we can have an initial carious lesion in these stages that we can treat with remineralization, we can arrest, or we can use the sealants for this. So the non-surgical, the so-called non-surgical secondary prevention. But when the caries becomes moderate, the range of activities that we can perform start from non-surgical to arrest the caries, but then goes to minimal surgical or generally to surgical procedures, so to remove mechanically the caries lesion. So it proceeds through all these stages of the caries lesion. So main treatment or main approach, our main approach in E0 lesion, when we have only to prevent, we have to take care with the fluoride, the correct oral hygiene and the prophylaxis and prevention. In this case, fluorides prevent demineralization and promote enamel remineralization, so increasing the resistance of enamel against acid attack. So this stage we have mainly to prevent and to have this approach to avoid carious lesion start on these surfaces. But then when we have very deeper lesion like D2 and D3 lesion in frank dentin, and they are most of the cases a cavitated lesion, we have an invasive drill and fill approach. We cannot do anything else that open with our burrs these cavities and restore with our composites. But there is a word in the middle between this E0 stage and the D2 and D3 stages. the E1, E2 and D1 stages, usually they are non-cavitated lesion, and so we can decide between a wait-and-see approach and and an invasive drill and fill approach. So we always have a doubt in this stage, because when we drill these cavities, we always sacrifice a lot of sound tooth structure. But when we wait and see, sometimes we have a development of the carious that will proceed to a bigger and bigger lesion, and so again a sacrifice of tooth structure. So today, in this case, we can proceed with carious infiltration. Carious infiltration aims to change the demineralization part of the enamel and the initial dentin, and to make it resistant again to the progress, to arrest the lesion. So this treatment fills the gap between prevention and restoration, the fluoridating preventive treatment and the invasive drilling and filling. So these fill the gaps in which we wait and see. Now we can perform these micro-invasive infiltrating lesions. And also we can treat aesthetically the difficult white spots. These lesions, like white spots or fluorosis or traumatic hypomineralization or molar incisor hypomineralization, are always a challenge for us aesthetically. Now, with this protocol, we can treat this type of white spot lesion, especially the cariogenic white spot lesion, mainly residual after removal of brackets in orthodontic treatment. In cases of mild to moderate fluorosis, we can approach these cases with this innovative treatment, a minimally invasive treatment, rather than a more invasive treatment. So passing from no treatment to the invasive treatments made by microabrasion, drilling and restoration, or veneers, we have this solution, the resin infiltration, the minimally invasive treatment that permits us to try to remove this white spot lesion and to obtain aesthetically good results for our patient without touching the teeth. And we will see how to deal with interproximal incipient carious lesion and the aesthetic treatment of white spots in this part of the not only endo series of lessons on Endo Channel by Gianluca Protini.